Let's say
right?
delirium is an acute change in your mental status, whereas dementia is a gradually progressive.
Okay.
So, yeah, delirium is extremely common in the hospital, and it increases somebody's risk of mortality and length of stay and things like that. So, and often it's the first thing that you might notice about your mom, that she's just not herself, and she might have a UTI or something. So that's something we see commonly. So older people are at more higher risk of delirium. Anybody can get delirium. A young person can get it as well, but very common in older people.
So when you see those early signs, I think, you shouldn't think, well, they're just getting old, right? I think, well, there are reversible causes, right? We should get that checked out at the very least, right?
Right.
And then there's some treatment out there too now. So
that said, I think we do check for those things and a number of other things. Some people check for heavy metals and neurosyphilis and that sort of thing. But I think that
how often do you see it?
Right. I've diagnosed neurosyphilis here. But I think
syphilis is on the rise.
The problem is that once we treat those reversible things, we often still have the underlying dementia, right? So,
I think there's some good studies that show that people who get memory loss from depression, that's just a harbinger of that they will eventually develop dementia.
It's very common in early dementia.
I have a question for Dr. Yazawa, and you can answer it or not. But being on both sides of the coin, you're an expert in geriatrics and things like that, but you also have some personal experience with it, being a patient and also, or a family member of a patient, and then also being a practitioner and a physician. What are some things that you learned being on the other side of the coin of that, if you don't mind me asking?
No, I don't. God, there's so much, right? I don't know. There's the financial piece, right? The care piece. I think, my parents, my dad especially, they wanted to age in place, right? And that's what most of us want.
Right.
He got a unit at Arcadia, at the assisted living facility, and I think he had to pay, I don't remember, it's somewhere like $600,000 to $800,000, right?
Because they have different levels in Arcadia, right, of care
just assisted living of buying like a 1-bedroom versus a 2-bedroom or a studio.
Right.
The down is like $600,000 to $800,000. Right?
Oh my gosh!
And what I notice is with my parents and even my patients, some people will plan ahead to do that.
Yeah.
And say, hey, someday we're going to make the move, but that someday never really comes because nobody really wants to downsize in that manner, right?
Right.
Unless they do it with a bunch of friends or their brother or something like that. But and so that's kind of what happened with my folks. I think they just, even though we thought they were ready to take the next step to assisted living, they just didn't, right? Yeah. So we brought in caregivers, and it's expensive, like she said. They're running $40 plus an hour, and then you can find people who will help, who are not part of the agency, and they'll do it for a little less, like $25 an hour. But it's
and it takes the whole family too, right?
Does.
It's like a whole village to come together, and who's going to take night shift and who's going to take day shift, and it's a lot.
Yeah, and they become more and more isolated in a way. How one of the M's she talked about was being around people, being socializing with folks, trying to keep people. That's such an important part of preventing dementia, I think. That person who is a very sociable person, I think in the long run tends to do better. My patients that are kind of living like hermits are the ones that develop dementia sooner,
Yeah.
And that's I think with my dad, that's kind of what happened. He's sort of regressed and kind of.
So what would you say would be, I don't know, some of the main pieces of advice you would give to folks, because we're in that age now where our parents are getting older. What would be your some really important points for people to know or start thinking about in terms of preparing for this?
Okay.
Or if you can prepare for it, it's
Yeah,
hard, right?
yeah.
You're never really prepared. Even if
Well, I'll give some. I'm sure Susan has a lot of good advice to share with us. I think for me, you could look at long-term care insurance. In the old days, our parents and their generation, they had long-term care insurance that covered everything. But that led to the collapse of the long-term care insurance market.
Oh.
And so today, there's only a handful of companies that have long-term care insurance, and they don't cover everything. It's almost like the 529 for college.
Right.
It's never meant to pay for all of
Everything.
college. It's just meant to defray the cost. So I think it helps, though, because most people don't go from home to nursing home in one step, right? It'll usually be sort of an incremental fashion. So they come home, but you need to hire daytime caregivers or nighttime caregivers. And if you have long-term care insurance, that could possibly, defray some of that cost, right? Because it's hard, I think, as family members to try to do that, right? Especially if you have young kids or you're still working.
I'll say that, caregiving is really hard.
It really
I think that's the main thing. And there's a lot of studies going on about caregivers, which have found that caregivers for patients with dementia have an increased risk of death compared to non-caregivers. And that's higher in younger and middle-aged caregivers. So that's kind of the sandwich generation that has kids and jobs and taking care of an older
And you think
parent.
that's probably just because of the tremendous amount of burden that's placed upon.
It's very stressful.
It is very stressful.
And
Yeah,
not a lot
it's-
of respite.
Right. And so there's all the financial, the kind of the physical stuff, just planning, and it involves the family. So I think to answer your question, I think talking as a family about kind of the what ifs. We all hope for the best, but we have to be prepared for the worst. And chances are, if you live long enough, you have a significant chance. I think cumulative risk after age 50 is like 44% of getting dementia. So, we all, one of us statistically,
It'll be me.
If we're 85,
It'll be me for sure.
Well,
You'll be fine.
I don't know. I think some would argue that a lot of men show some.
Oh yeah, that's right. Never mind.
Memory problems early on in life, right?
Well,
Can't seem to remember what.
I think that's selective hearing, not memory.
I don't know.
I'm not sure.
Well, something going back to what's unique in Hawaii, the cost of living or buying a home.
Yeah.
So if you're not prepared and you don't get this advice from an attorney who tells you get rid of all your assets and your parents are not willing to get rid of all their assets at the end, that family home is something a lot of us hope to get someday because we can't afford to buy our own home.
Yeah.
And then that becomes a problem in a sense, right? Because if they need caregiving, you're either going to have to take a line of equity or reverse mortgage.
Or sell the house.
Or sell the house, which you don't want to do because that's the house that you hope to get.
Yeah.
Because that was grandma's house.
And that was the house your parents were probably hoping to give to you. Anyway,
Right.
Right. And so then, you try to be a caregiver, right? And it's not easy.
Yeah.
There's a lot of community resources to try to help that out.
And you mentioned respite. So respite care includes daycare. So there's a lot of daycare programs on island. It costs between $75 to $100 for 8 hours. So that's a good way to have somebody in a safe place where they're socializing and doing things. Home health aides, so having somebody come into the house and help with cooking and kind of like babysitting. And then there is inpatient respite. So say you're going to have surgery and you're taking care of somebody with dementia, you can place them in a care home or some other facilities, temporarily for a couple of weeks, to get a break.
So it sounds like looking into long-term care is an important part of planning, long-term care insurance.
Well, it's not for everyone because you have to be able to afford
it.
the premiums, right? But to start thinking about, like Susan said, think about the future. Who's going to be your financial power of attorney,
Yeah,
right?
that's really important.
Who's going to be your financial power of attorney?
And your healthcare power
And
of
your
attorney.
healthcare
So,
power of
And
attorney.
healthcare.
we all need to do that.
Yeah.
So if you're one, you're not necessarily the other. It's not assumed
Correct.
that
It
if you're
doesn't
the
have to be the same
healthcare,
person.
you'll be the.
Are there? Do you know if there's somebody, a professional out there that can advise people about these things, like somebody to give them advice, like a financial advisor would give you advice about, hey, you should be investing in this, you should be doing this, right? Is there somebody that resources out there that that can help families look into long-term care insurance or talk about financial power of attorney or give them ideas? Because some people wouldn't even know what to ask about what to prepare for in terms of having this happen, right? Which we should all plan for because it's inevitable.
Right. So there are legal services on island, free legal services. I think a lot of my patients have trusts, right? So that generation, they took care of all their planning ahead, and these documents, the healthcare power of attorney and the general power of attorney, are always part of a trust that you execute. So we should probably all get trusts too. But you can do the financial power of attorney. There's a state of Hawaii form you can download, and it has to be notarized, but you can do that.
There's Hawaii Office on Aging. Right?
Yeah.
I think
yes,
they
yes,
put out they have a book. like a book.
Kokuamau
Yeah.
is a good. Well, that's mainly for healthcare planning, but yeah.
Yeah.
What is that? What is the name of that again? The what? Office of
Office of
Is it-
Elderly Affairs and
Office of Elderly Affairs. Is that what I know? They put a booklet out that has a lot of resources like respite care, care homes, daycares, and then she mentioned Kokuamau, which is
Kokuamau.
Kokuamau. Yeah.
Yeah.
So they're the advanced care planning people. So they're really about.
Because without that document, you assume that a patient's spouse or their first son or first daughter is going to be the person making that decision. But you'll be surprised, people who tell me, well, I kind of trust my sister. I want my sister to be, not my spouse or my child, So it's good to get that known out there.
Yeah.
So I think it's important. What you're saying, another important thing is to have this discussion with your family members. Yeah. Yeah. Because
it gets messy if you don't do that, and then if the older parent has a house, that's worth $1 million plus typically, and siblings it can get nasty when there's money involved, right? So it's good to have all of your legal documents in place.
Yeah, it's funny because I see commonly it's usually the kids, right, brothers or sisters, that fight about what mom or dad wanted. Even though they do have a a health directive, right? And a lot of times people don't even realize it's their own guilt, right, about not being around for mom or dad. So mom breaks their hip in Hawaii, daughter's in Chicago, and then the brother's here taking care of her, and they say, mom wants to have the surgery, and then daughter's like in Chicago arguing that mom's 87, she doesn't need a surgery, blah 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 blah, or vice versa, right? Because they're trying to feel like they're doing something for their mom, but they don't realize that mom already had the do not resuscitate, for example, on her living will. But then they argue about that.
Yeah, you have to talk to your family about those wishes.
Yeah. I've made it clear to my kids, what's happening to me. I'm just worried that I'll have dementia. I'll forget what I was supposed to do. Because once that happens, I don't know,
People lining out the door to pull your plug.
I want to be out of here. That's me personally, but,
I know it's the quality of life that matters, right?
Yeah,
it's not. And even these new treatments, they're great.
Yeah.
But at the end of the day, it's quality of life and who's around you.
Yeah.
And quality of life can change for people, right?
Yeah.
I mean, right now we talk about, well, if we can't do everything we want to do, that I don't have quality of life. And I eventually get patients that tell me, well, if I can eat ice cream every day and visit my grandchildren can see me once a week, that's quality of life for me, right? Which is far different from what we're thinking quality of life is. So that can change, I think, with age, you know? So.
Yeah, that's true. I have some hard stops though.
Oh, really?
Yeah.
Like what?
I promised my daughter she will never have to wipe my ass.
Oh, yeah.
If I break if I break my arm and I have to recover and I can do it, it's fine. But if I get to the point where I can't take care of myself in that way, I'm out of here.
You're done.
Yeah, I hope I don't leave a mess for them, but I'm out of here.
And you know, it's funny that you mentioned your daughter, because I think, just anecdotally,
Yes.
I have patients with 6 sons and 1 daughter.
It's the daughter.
And a daughter is often the saving grace. Not to say that there aren't sons that will step up and do stuff, but the daughter. And then sometimes I see the adult grandchild.